Hi, I've got a very exciting announcement today. We're just about to launch the brand new Assist with Corrections, and here with me today is Dr. Astrid Birgden, who is a consultant forensic psychologist and was also a former director of a drug treatment prison. And she's here to talk with me about this new innovation. And Astrid, let me start by asking you, who do you think would best benefit from having access to this and using this resource?
I think it's a very good resource for people who are screening offenders as they come into the correctional system, whether it's prison or community corrections or even juvenile justice, because there are risk of reoffending tools for sex offenders, family violence, violent offenders, but not specifically for drug-related offenders. And so the connection has to be made between the risk of reoffending and the substance use, and what the relationship between the two might be.
Okay, so potentially quite a broad audience. And as they look through the material, what do you would say would be some of the key messages that you would expect them to get out of this?
I think using it as a screening tool to look at issues around substance use, and then secondly to look at the relationship between the substance use and offending, to work out whether there's a direct causal link. There might be a third cause that underpins both, like mental health problems, and the third relationship would be just generally living in a fairly antisocial lifestyle that includes offending and drug use. So it would help a person tease that out so they can work out how best to formulate treatment for the person. And the other thing that the tool could be used for is pre and post measures as somebody moves through the correctional system and undergo either drug use programs or drug-related offending programs.
Right. Okay, so it sounds like there are many opportunities to use the Assist with Corrections and would fit comfortably within their current work practices. I guess that the resources that we've developed to date have been predominantly aimed at the health sector. This is the first product that we've developed in consultation with the corrections sector. Can you tell me what would set it apart from the other resources that we've developed that is quite unique and different?
Having run a drug treatment prison, we were looking for tools that were applicable to drug-related offenders, and so this tool can be used outside of just the health setting, and it connects in with theories that we already use in corrections, like motivational interviewing, the risk-need responsivity model, so it would enhance, one of the factors is drug and alcohol problems, so it would provide more information around that area, and it would tie in well with the Good Lives model, because you're trying to get the storyline for the offender between their drug use and their offending behaviour.
Great. So this has been purpose-built for this sector. You want to get a copy of it, then you can go to the Assist portal and order your copy through the link there. Really excited about the product and hope you get on and start using it.